Welcome to our last health education video. We will be discussing patient advocacy. We believe that the informed patient is the best advocate. This video provides information for kidney disease patients to be effective advocates for themselves and others. By being involved in your own health advocacy, you not only gain a greater sense of control, but also an increased confidence over your decisions, greater medical literacy, better treatment adherence, and even better health outcomes. To become your best advocate, understand how your health insurance works. Many Americans don't understand the basics of their insurance coverage, and understandably so. Health insurance is complicated. Knowing how your insurance works helps you navigate the healthcare system with less chance of ending up with costly, unexpected medical bills. Visit sites like healthcare.gov to watch videos and gain a better understanding of how most health insurance policies work. Contact your insurance provider with questions on your specific policy. Allow them to break down what is covered and not covered by your policy and how you can minimize out-of-pocket costs. Don't be afraid to ask questions. Patients should prepare for their doctor's appointments by making a list of questions and concerns ahead of time. Though many patients are nervous their questions may disrupt a pleasant doctor-patient relationship, this is not the case. You are not going to have a lot of time with all your providers, so it is in your best interest to know what is going on and have your questions answered. If you feel uncomfortable, you can even rehearse your questions with the ultimate goal of nurturing a great partnership with your doctor. Eventually, you can get past a one-way, they talk, you listen relationship. Maintain your own health records. If you've ever switched doctors or seen a specialist, you know what a hassle it can be to have your records transferred. With the growing prevalence of electronic health records, maintaining your own copies is easier than ever. By keeping tabs on your own documents, you won't have to worry as much about them getting lost in the shuffle, and you can see exactly what your doctors are seeing. Review your medical bills for errors. An estimated 8 in 10 medical bills contain errors. Errors that go undetected without the sharp eye of an empowered patient. Medical bills can be difficult to decipher. We recommend patients ask questions as they arise, even if they seem obvious or ridiculous. When it comes to your medical bills, play defense. Assume that if something can go wrong, it will, and take every possible step to make sure nothing does. Remember, it's your money, so you're in charge. Know when a second opinion is appropriate. 1 in 20 Americans fall victim to outpatient diagnostic errors, according to the Agency for Healthcare Research and Quality. And even if you're comfortable with your doctor's diagnosis, seeking the input of another physician could save you from unnecessary medical costs and unnecessary stress. Generally, any recommendations for major non-emergency surgery, any questions about the validity of your diagnosis, and any concerns you may have about not being heard are good justifications for a second opinion. Just make sure to check your insurance coverage before you make that additional appointment. Take advantage of free preventive care under the Affordable Care Act. With the Affordable Care Act came access to free preventive care. If you're insured under an Affordable Care Act compliant plan, and if your health insurance began after March 31st, 2010, you likely are. You can take advantage of at least 15 free health screenings and services. Additional preventive services are available for women, children, and older adults. These free services give you an additional reason to visit your doctor, keep the lines of communication open, and stay on top of any potential health concerns. You don't need to feel intimidated by your medical providers. They work for you, not the other way around. And when the common ground in these relationships is your health, it's in your best interest to be as empowered as possible. Involvement in clinical trials is another way to advocate for your best healthcare. ClinicalTrials.gov provides current information about clinical research studies to patients, their families, and caregivers. Each study record includes a summary of the study protocol, which describes in detail the plan for conducting the clinical study. It also includes the recruitment status, which can either be open or closed, and the eligibility criteria, which describe characteristics that must be shared by all participants. Eligibility criteria can include age, gender, medical history, and current health status. Even though clinical trials can provide access to new drugs and treatments that can be beneficial, there are risks to being involved. The potential risks include new drugs and procedures that may have side effects or risks unknown to doctors, new drugs and procedures that may be ineffective or even less effective than current approaches. And even if a new approach has benefits, it may not work for you. Discussions with your healthcare providers will ensure which options are best for you. Lastly, patients like you can advocate for yourself and others through your local government. Websites like the American Association of Kidney Patients and the American Kidney Fund supply patients with articles on public policies being discussed in Congress and other federal agencies like the Centers for Medicare and Medicaid Services. These two organizing bodies have a direct impact on the quality of care you receive. These websites even make it easy for you to contact your local members of Congress and make your voice heard. We hope that this video makes you feel more empowered to fight for quality healthcare. We have enjoyed talking with you during this health education series. Thank you for taking the time to learn more about your kidney disease. The most important thing in education is to make people think for themselves. Albert Schweitzer.